I'm Brian Urban. I'm the head of population health here at Best Buy Health, helping usher in the next iteration of what that means for the healthcare ecosystem. So our booth, I think, is a quintessential piece to what health represents. It's really advancing healthcare through technology and meaningful partnerships. It's a large part of our mission at Best Buy Health as well. And as you can see, our booth is just on a perfect spot in the corner, not just because of the Geekmobile, but because of the authentic people that we have manning it as well. So energy, impacts, and meaningful connections is the vibe here. And I see you all setting a precedent that I don't know if it's going to be caught up with in a lot of the other venues across the country. You come here, and it's something that you can feel. It's almost undescribable. To me, I've been across the US and beyond at a bunch of different conferences around policy, clinical practice, technology. They're all kind of in this spot where they're flatlining in terms of connections and material things that come out of it. I already had 5 meetings, pre-scheduled and spontaneous yesterday, that have all materialized in something real, that we have a targeted partnership, we have targeted customers, and we have an actual puzzle fit in terms of a strategy. So it's the speed to impact that I think HLTH Health has ahead of a lot of the other conferences I've been to. Energy, impacts, and you could say material or meaningful connections, because what you get here is authenticity. You're not flooded with a lot of disconnected vendors and core health plans and healthcare systems. Everything is here for a very distinct purpose. So I think John opened up very well saying we want everyone to be bold. He said something really specific that rung true to me, which is bold risk takers. I've always been an oddball across the ecosystem. This is the next generation of oddballs that are wanting to push the envelope, find new ways to actually change not only the economics in healthcare, but how people are seeing the healthcare system and maybe trusting it or distrusting it, and what the gap is that we can all address. Anyone that wants to make a difference, that isn't afraid to push and advance some of the policies that exist today for what they could be tomorrow, top down and left to right. Everyone that's in this ecosystem needs to have a part. If you have a voice, it should be shared here.